In this video, we're providing multiple examples of exercises that can be used to target the balance deficits that people with Parkinson's often have. This first exercise is called multidirectional stepping. This exercise promotes movement initiation and challenges balance when moving the center of gravity outside of the forward direction. This is essential for patients with Parkinson's when they are performing ADLs in tight spaces like a kitchen, laundry room, or bathroom. In order to execute this exercise, have a T-shaped pattern outlined on the floor with tape, bands, etc. Begin with the patient standing in one box with the PT guarding closely. Going in a clockwise or counterclockwise direction, cue them to step both feet into the adjacent box in one large step, while maintaining upright posture. As the patient improves, call out random directions rather than going in a circular pattern. If the patient becomes too unsteady, cue them to recover their balance before transitioning to the next box. The next exercise is balloon toss on foam. Because those with Parkinson's struggle with movement initiation, reactive balance and postural control is difficult. This exercise challenges a patient's reactive balance and postural control due to the unpredictable movements of the balloon and the unpredictable response of the foam. These types of movements are required every day with activities such as walking or standing on uneven surfaces, walking in windy conditions, standing in a train or a bus, and walking around crowds or pets. To set up this exercise, have the person start off in a position that is moderately challenging for their balance, such as standing on foam or with a narrowed base of support. While guarding your patient closely, have another person toss a balloon to the patient. Cue the patient to hit the balloon back to the other person and repeat. Cue your helper to hit the balloon in random directions in order to encourage the patient to move their center of gravity outside of their base of support. If they begin to feel their center of gravity move outside their base of support, cue them to recover with a step. Sit to stands on foam simultaneously challenges balance and strength in a functional way to improve the patient's ability to stand from sitting. The addition of foam further challenges static balance and forces the patient to be aware of where they're putting their weight. This is a good exercise to perform strengthening with instability. Begin with the patient seated with a foam mat under their feet. Cue the patient to stand up without using their upper extremity support and without pushing the back of their knees against the mat or table. If they're struggling to come to standing, consider adjusting their feet to be more underneath them or cueing for a bigger anterior trunk lead. Otherwise, adjust the table. Increase the challenge by having the patient step up to a knee drive. Those with Parkinson's tend to have forward trunk lean and posterior pelvic tilt, which shifts their center of gravity posteriorly and therefore makes it difficult for them to shift their weight without festinating or losing their balance. This exercise asks them to maintain balance during an anterior weight shift in a functional way, as it is simulating maintaining single leg balance on curbs or going up steps without a handrail. This exercise also simultaneously will target posterior chain muscle strength, which is often weak in individuals with Parkinson's and is essential for postural stability. Begin with the patient standing in front of a step. In one fluid, quick motion, have the patient step one foot onto the step, then drive their opposite knee upwards in a marching position. Cue for glute activation and upright posture on the stance leg. Hold the end position momentarily. Then have them slowly return their opposite leg to the ground and step off while maintaining their upright posture to the start position rather than falling into it without eccentric control. People with Parkinson's have reduced amplitude of movement, difficulty initiating movement, and a difficulty moving automatically or without conscious thought. In addition, the tendency to shuffle and festinate impairs someone's ability to recover a loss of balance by taking a step. This exercise shifts the center of gravity outside a normal base of support and encourages them to maintain balance as they step. Begin with the patient standing without upper extremity support and the PT guarding closely. Have the patient take a quick, large step forwards, backwards, or sideways and plant their foot firmly, cueing for upright posture. Then have the patient slowly return to the starting position in one smooth motion, cueing glute activation and upright posture as they pull themselves back. Consider using a visual cue on the floor for them to step over or to. People with Parkinson's generally have difficulty with single leg balance due to forward trunk posture and hip weakness. Trunk rigidity can also make shifting weight difficult. This exercise challenges patients to activate their hips and practice appropriate weight shifting, which is essential for successful navigation of stairs and curbs, especially when no handrail is present. Begin with the patient standing in front of 3 cones. Have the patient lightly tap one cone in one smooth motion, cueing them to stand tall and move with good body control rather than throwing their leg into the motion and back to the floor. You can increase the challenge by increasing the height of the cone or having the patient tap all 3 cones before returning to the starting position, or adding ankle weights around their feet. Reaching with static stance challenges a patient to shift their weight anteriorly without losing their balance. It helps with functional reaching during cooking, cleaning, grocery shopping, and other ADLs. Begin with the patient standing feet together at a counter with cones or other graspable objects at various locations that require the patient to lean in order to reach, but that can be reached without taking a step. Cue the patient to grab the objects without moving their feet. Increase the challenge by moving the objects farther away, having the patient perform cross-body motions, or changing how high the objects are. Perturbation training challenges reactive postural control by shifting weight in various directions to respond to unexpected perturbations. It also secondarily challenges the ability to react to a loss of balance with a stepping strategy. Begin with the patient standing feet shoulder width apart. Instruct that a perturbation will be provided and that their primary goal is to recover their balance without taking a step. If, however, the perturbation is too big to do so, encourage them to recover their balance with one large step rather than multiple shuffling steps. Begin by providing small perturbations in a regular pattern. As the patient progresses, increase the strength of the perturbations with the goal of having the patient occasionally need to take a step. Perturbations should be quick and almost jerky pushes rather than slow, smooth pushes. Increase the challenge by varying the direction, speed, and intensity of the perturbations.